Okay, so for the purpose of this video, you are patient John, and you are a 52-year-old man, and you've had back issues, low back issues, and you're a mechanic. So you're bending down a whole bunch, and you got some things going on. So today we're going to be going over your informed consent. And so I'm going to have you sign some paperwork that we're going to go over about it, okay?
Okay.
So the first thing that we're going to talk about is your diagnosis. So what I've come up with today is I think you've just got some degenerative disc disease going on. And so we did a bunch of tests on you, if you remember, and some of those things were positive. And we ended up doing x-rays, and we really didn't find some significant things on the x-rays other than some narrowing of the disc space, which is why I think that you've got some degenerative disc disease going on. And so if you decide to not go forth with this treatment, your prognosis is going to be that your symptoms are probably going to get worse, and that you may not be able to go back to work. You're going to be in a lot of pain. So I want to let you know the treatment plan that I think will help you. So initially I want you to come in 3 times a week for 2 weeks. And in that time I want you to take off of work. So when you're coming in, you're going to come in for different types of treatment. We're going to do some laser treatment. We're going to do some adjustments and some strength and conditioning, some mobility and things like that. And after 2 weeks, we're going to see if you've improved a little bit so that you can return to work. And then in 4 weeks, we're going to do another exam to see how things are going, okay?
Okay.
And so I think that some of your benefits from this treatment are going to be your pain is going to be reduced. I think you're going to feel better probably after the first treatment. I think you'll feel somewhat better, but especially after you've come for the first 2 weeks, I think you'll feel significantly better. I think you'll be able to return to work. I don't think that you're going to be healed completely because we can't reverse degenerative disc disease. It's something that we can slow down, and we can strengthen the muscles around it so that your body is not in so much pain, and those muscles can help compensate, okay? So you're understanding that we're not going to fix the problem exactly, but we're definitely going to make it better, right? Okay. And then there are some risks from chiropractic adjustments, which at this time, I don't necessarily plan on adjusting your neck, but you know that with upper cervical adjustments, there is always a risk with a stroke and things like that, but it's a very, very small risk. So at this time, the risks are going to be more from not getting the treatment. Because we're going to be doing some pretty low impact things. So we're going to start out with these blocks, and you're going to lay there and your body's going to essentially correct itself for a little bit, and it's really going to help you get out of pain. So we're going to put these blocks in specialized places, and then we're going to progress to another technique called Thompson drops. So both of these techniques are very low risk, and it's going to help get you out of pain. Okay?
Okay.
All right. And then there is alternatives to this treatment. So obviously you can go see a medical doctor, you can have injections done, you can take pain medication, you know, and then there's risks associated with those things as well. And if you do decide to go see a medical doctor, we can co-manage these together, and you're always welcome to get a second opinion. So just always let me know, and let me know if any type of medications change or any pain or anything like that changes. And do you have any questions for me?
Mm-hmm.
You do? You have a question?
Yeah.
What's your question?
Am I allowed to say it?
Yeah.
Is John a real person?
For the purpose of this case, it's a real person. So I'm just going to have you sign that you you're just going to sign your name.
Okay.
John.
Okay.
Thank you.
You're welcome.